The question was spinal or general anesthesia. At this hospital, we use a general anesthetic. We combine that with what's called a nerve block. So prior to your surgery, in the preoperative holding area, the anesthesiologist places a catheter up near the groin, which gets the main nerve that goes down to your knee, and then you are asleep for the operation. The operation, partial knees take about an hour, total knees about an hour and 15 minutes. After you wake up, your leg is typically not completely numb, but the part that is most painful is numb for 24 to 48 hours. So we do a very good job of controlling your pain afterwards. We don't do spinals at this hospital for knee replacements because spinal anesthetics can make your legs completely weak and numb for sometimes 2 or more days after your surgery, which greatly limits your rehabilitation. If you can't walk, you can't rehab. So we do the surgery, we let you sleep the first night. The next morning, it's time to go to work. The therapists bring you breakfast and then they get you out of bed. So that's been shown, not just here at our hospital, but at many other hospitals, to be a more effective way of rehabilitating people after knee replacement than delaying rehabilitation. So that's the reason we use a general. Yes, ma'am. Not many implants use titanium because it's a soft metal and it's not as durable. There are 4 or 5 major manufacturers of knee implants in the world, and with one exception, they all use the same metal alloy. It's a combination of cobalt and chromium. Sure. Yes. Yeah. Right. Sure. Sure. Well, for partial knees, the answer is easy. It doesn't matter if you're a man or a woman. We make the knee for your knee. So no matter what size you are, big or small, man or woman, you're going to get a knee that fits you perfectly. For total knee replacements, there's a company called Zimmer. The 3 big manufacturers of implants in the U.S. are all based out of Warsaw, Indiana, interestingly enough, and Zimmer is one of those companies. And they developed a product that they called a gender-specific knee a number of years ago, which was marketed as being specific to women. You know, women in general are smaller, but their knees are also typically more narrow. And so in some instances, you go in to implant a normal knee, you know, a normal conventional off-the-shelf knee into a woman, and it might be slightly too large or slightly too big front to back. And so they made what they called a gender-specific knee, and were very effective in marketing this, and that's probably what your mother-in-law had. Yeah. Well, I was going to finish, but so since then, there's been more research done on what exactly is a woman's knee, why is it different than a man's knee, and now all of the companies have different sizing appropriate for both men and women. So it's hard to get a knee these days that is grossly misfit whether you're a man or a woman. They make a number of different sizes. They're not specific to you, but there's enough sizes now that they usually fit very well. Yeah. Yeah. In general, the 2 most important things to maintaining your knee health is maintaining your weight and maintaining your activity level. If you get overweight and you stop exercising and then you stop moving your knees, that's going to lead, if you're predisposed to it anyway, to the acceleration of the arthritis. If you can maintain your body weight in a reasonable range and maintain your exercise, whether it's walking, swimming, bicycling, what have you, there's no question that your knees are going to last you longer and you're going to possibly be able to put off having surgery on your knees. There are some people that are genetically predisposed to developing arthritis that no matter what they do are going to get it. I mean, one of these slides was a guy who's obviously very thin. I know this man very well. He's an exercise fanatic, takes good care of himself, but he got knee arthritis anyway. So sometimes it's going to happen. But if you want to do your best to prevent it from happening, those are your best options. Medications like osteobiflex usually contain a combination of something called chondroitin and glucosamine. We used to, as doctors, sort of discard those medications as being, snake oil. They don't work, but they've actually been studied now, and they are beneficial. There's no known side effects of those medications, and compared to placebo, compared to sugar pill, those medications help with pain relief. So if people ask me about it, I tell them to go for it. I mean, aside from the cost of the medication, there's really no downside. Yes? Yeah, sure. Chondromalacia is just the medical term for cartilage damage. And so if you break down that word chondro as cartilage, and malacia really means softening, so it's softening of the cartilage. And so chondromalacia is kind of a pre-arthritic condition. If you have a knee that creaks and grinds and hurts you going up and down stairs and hurts you to kneel, but otherwise, once you get going, it feels pretty good, and you can work through it, you probably have chondromalacia. You're not to the point where you're rubbing bone on bone, but your cartilage is starting to show signs of wear and softening. So with those people, depending on the severity of their problem and how long they've had it and what they've tried, I almost always try an exercise program in combination possibly with some physical therapy, weight loss if necessary, and medications. If those things don't work, I'll almost always do injections. There's several different types of medications on the market: Synvisc, Suparts, Euflexa, a couple others that are lubricants. If those don't work, I'll scope the knee. Scoping is a very minor operation. We put a tiny fiber optic scope into the knee and just shave off the damaged part of the cartilage. And although that doesn't take it back to where it was normally, at least takes it back to a better place, like hitting Control-Alt-Delete on your computer. It takes it back to a better place, and then it can buy you some more time until you finally have to have something more done to your knee. So, sure. Yes? Yeah, the Unispacer was a device that was actually a piece of metal that was placed between the tibia and femur to give greater space to the bone and hopefully delay the need for a total knee replacement. I never used the Unispacer product itself. I used a product that was similar to it, and most of those products have failed. The Unispacer failed miserably. That had a failure rate of about 2 and 3, so that's off the market now. But there are no, that I'm aware of, there aren't any spacer products currently available. There was one made by this company that makes the partial knee that I use that was potentially going to be a better alternative to the Unispacer because it was custom made also like their knee implants. But it's just not a very, it's not a very popular option, and it never worked as well as it was supposed to. So those products have all been taken off the market, and I'm not aware of any research that's being done to replace it. Yes? Oh, you're talking about after surgery? Yeah. There's something called a CPM machine, stands for continuous passive motion, that you can rest your leg in and it passively bends your knee back and forth. We used to use it all the time, actually. There are several reasons we no longer use it. Number one is that the studies that were done on the use of CPM and not using CPM after surgery showed that the results were equal. There was no benefit to it. And secondly, Medicare stopped paying for CPM, which made our decision a lot easier. So you can rent, if you choose to, a CPM machine at $50 a day or something, but most people 2 weeks after surgery don't know the difference, so we no longer use it routinely.
So what do you do after that? You let the person sleep for 4 days, and then you go through a couple of days here in the hospital with physical therapy, which is probably horrible, but what do you do after that? What is the...
Once you leave the hospital?
Once you leave the hospital.
Yeah.
That 2 weeks that we don't
Sure. The question was, what do you do when you're discharged from the hospital during that first 2 weeks before things start to get better? There's several options. If you're in need of a lot of help, which some of our more elderly patients are, there are rehab facilities that you can go to. unfortunately, as with everything else, Medicare is increasing their requirements and decreasing their payment for rehab facilities. So it's hard to get people qualified after knee surgery for rehab. So alternatives to that are to do home therapy. You can have therapists come to your house. That way your husband or wife's not having to drive you to therapy every day, and you can stay comfortably in your own house and get your therapy done. Or you can come on into the hospital and get your therapy done here. It just depends on your own personal situation, your activity level.
You can come back every day to physical therapy here in the hospital.
Yeah, most people do it 3 times a week. Coming in every day is desirable, but it's just hard to do. I mean, we've all got lives outside of our knees. So most people do a Monday, Wednesday, Friday, or a Monday, Tuesday, Thursday, or something like that, and then do the exercises aside from that time on their own at home. So there's different alternatives, and those are the 3 main ones. You do it at home, you come in here and do it, or you go to a rehab facility.